Tana, a couple years ago, we did our telomere tests through teleo years, I think. And we did it with ourselves, with some of the staff here in the office. And the results were really disappointing on looking at some of them, especially some of them that were so low. To the point to where we actually got on the phone with the lead folks there and with our chief medical doctor and said, how on earth can there be such discrepancies? And how can we look at somebody who we would think would have an awesome score and have it be so low? And they admitted that, it's not a perfect science yet and they're still learning about it. But one of the things that they brought up as a primary, causation of a bad telomere health was an ACE score, adverse childhood effects. Really? Well, and that's what really got us on this tangent of, can you overcome it? What do you do? And I did not realize it, especially me as a layman's guy over here, of how impacting that really was, not just from a psychological standpoint, but our literal health. So here we are in America with chronic illness and disease going through the roof, as you know, wondering how does trauma affect that? I had you on the Ziegler show then talking about your story and so much trauma, and you're the brain warrior, and what better person to have on and talk about this. And you said you've just been looking into ACE score specifically.
Yeah. Yeah. So interesting. So thank you for having me on. I just wrote my book, The Relentless Courage of a Scared Child. And I'd been sort of nudged by my husband, Dr. Tana Amen, who is a psychiatrist. And when we were dating, and I was telling him bits and pieces of my story. And when a psychiatrist is quiet, that's a bad sign. He would just look at me and I'm like, what? And, and I would tell him these stories. And I remember telling him, about the time that my uncle was murdered when I was 4, and it was in a drug deal gone wrong because of my other uncle who lived with us, who was a heroin addict and who overdosed shortly after that, tried to commit suicide. And I was telling him these stories, and this was in my life was normal. This was the norm in my life at the time. And my mother was never there. She worked 3 jobs. She was a 16-year-old runaway and lived on the streets for a while. And so I'm telling him these stories, and he's like, really? And so about 2 weeks after my uncle was murdered, that's a day I'll just never forget. It was a really scary day. I was terrified. I remember the screaming and being pushed away. Now as an adult, I realized they were pushing me away, trying to sort of save me, protect me from what was going on. But I just remember being terrified and hiding and thinking that hiding was safer. Always looking for that tiger around the corner because something bad always happened in my house. But 2 weeks later, I was in the hospital having upper and lower GIs, so gastrointestinal studies. I was always sick. I was that kid who was always in the hospital, had high fevers that were unexplained. No one knew why, and just didn't know. Constantly on antibiotics. I've had 10 medical surgeries to date. I've had cancer 3 times. So always had things going on, and nobody really understood the reason why. So I went on this journey to sort of figure it out for myself. And, I remember telling my husband about some of this stuff, and he goes, wow. He's like, that's obviously connected. And I'm like, no, it's not. This is way back. And before I went on this journey, I'm like, of course it's not connected. I'm like, don't give me a bunch of psychobabble, because it was my protective reflex was to think, no, they're not connected. I didn't have it that bad. I was trying to think that my childhood wasn't that bad. And I'm like, this was not all in my head. Don't tell me this was all in my head. But he's like, why would you think that's not connected? Trauma affects how so many things. And that's what got me thinking and going on this journey of understanding what trauma does to us, especially at such a young age. And new studies, and please correct me if I'm wrong, but these studies that I've been looking at, when children go through childhood trauma, it's a little like soldiers that come home from war. That's what it's doing. Now imagine doing that over and over and over to a developing brain.
Yeah. When you look at, so you're talking about PTSD, and I know you talk a lot about PTSD as opposed to post-traumatic growth,
right?
In that, and you say in that you, as a kid, it was your norm. You didn't see it as that bad. I would tend to think, well, isn't that better than thinking it was so bad? Is there a benefit?
I think that the benefit is, I don't know that I had a choice. So to survive, you sort of have to do that, but it still takes a toll on your body. And I don't know that we realize that because we're in it. So even my nieces, we adopted our nieces right before quarantine because The sad thing is when we're talking about ACE scores, we're talking about ACE scores right now and the effect that it has. These things, I always think about the Bible when I'm talking about this. And, we talk about, to the fourth generation that are,
Mhm.
the sins of the father to the fourth
Yeah.
generation. Well, what's really fascinating to me is that when we do this, when we come from traumatic backgrounds, what the research I've done is, yes, it affects our telomeres. We're talking about telomeres and aging and all these things that happen, how trauma affects us and our health. It actually puts you at risk for 7 of the 10 most common causes of death. So it puts you at risk for the 7 of the 10 most causes of death, and significantly, like it increases your risk significantly when you grow up in trauma. So, but what's really interesting is that it doesn't just put you at risk if you grew up in it. What happens is it damages your DNA and you pass that on to your children. And that's what really got my attention, because I don't want to do that to my daughter. But what's really exciting for me is that if you learn how to, if you learn, they don't really talk about resilience. If you learn how to manage it, if you learn about post-traumatic growth, if you learn about what to do to counteract some of that stress, that's what's exciting to me. Because I can't change the fact that I grew up in this nonsense and this craziness. I can't change that. But what I can do is do everything in my power now, right? And I can, even if some of the damage has been done to me, I can hopefully affect the next generation. We adopted our nieces right before quarantine because my sister, my half sister, is still, sadly, the disease sometimes wins. They were put into foster care. Both of her parents are addicts. It's a mess. A lot of people in my family still have a lot of challenges, but we get to change the next generation by helping them now.
That that speaks to us so much. We use the word resiliency a lot. And the fact is that we all have had trauma.
Mhm.
Nobody escapes from childhood unscathed.
Right.
And your story is an example of the extreme.
Mhm.
And we use the extreme all the time, whether we talk about, what are the consequences of the extreme toxin exposure, or here's somebody who smokes or something like that when it comes to the physiology. Your story is somebody who is in war or something like that. These are the extremes. And we say, okay, yes, PTSD and these things are real. It shortens telomeres. It does damage to DNA that is now measurable. And just like we all also say, nobody can eat perfectly. We've all had toxins come into ourselves. But the exciting thing is, wherever you are on that spectrum, you have some, not all, but some control over the future. You can change the way your telomeres are healing, the way your DNA is healing, and affect. That's right. So the sins of the fathers could affect negatively to the fourth generation, but also the righteousness of the fathers can also affect
Yes.
positively to the next generation. And that's the hope.
But you guys, Tana, you and Daniel, and in your clinic, and obviously Randy, you and yours, I mean, you're seeing patients, and you talked about this. There was a point where even Daniel was saying, come on, those don't correlate. And then you went on that journey to find that they do. I mean, have you always, with patients, as you have the next one coming in with whatever chronic illness and disease they've had going on for the past decade or all their lives, and you're looking at, their lifestyle and how they eat and the deficiencies, and doing a blood test doesn't show, oh, they were beaten as a kid, or whatever it may be,
Right.
whatever the trauma is. I mean, was there a point where you realized the effect that you asked that question? Hey,
Yeah.
tell me about.
And I'm sure Dr. Amen will as well in the questionnaire. And so the way I phrase it to people is, look, we're all on the spectrum of everything, right?
Mhm.
Like I would not say that I was a childhood abuse survivor, but nor were my parents perfect.
Mhm.
So to what degree, and then and we ask every patient, in your childhood, was there abuse?
Mhm.
And if there's any hitch and a momentary wait, I'm like, all right, you don't have to tell me all the details, but let's put it on the table. And I'll ask the same thing about marriage. So in every marriage is conflict,
Right.
right? It could go all the way to abuse, but normally people, if the abuse is there, there'll be a hitch, and then you say, okay, doesn't it make sense to think, like you just said, that 7 out of the 10 top reasons why people die, your ACEs score is going to have a dramatic effect on your blood pressure, cholesterol,
Yeah.
Alzheimer's, all of these things.
Addiction, like all sorts of things.
But I mean, you're in the medical community. I don't, I mean, I've been in it as long as I've been working with you. So the past 6 years, and we're reading, Hyman and Mercola and all the stuff. I still didn't see that as a front runner. And for you to make that statement makes it feel like, oh my gosh, why isn't this?
Why don't we always talk about it all the time?
Yeah, I didn't either until I started really digging into it and then looking at my own health. Like I said, I've had 10 medical surgeries, weird things. And I'm like, why is this happening? I'm so healthy. I eat healthy. I exercise. I do all these things. This doesn't make sense. And so that's when I started digging into it. And I'm like, some of the damage is done. Now I feel like I'm in my 50s and I'm healthier than I was in my 20s. So I do feel like you can at least do damage control. I do feel like you can do some damage control. But what I'm like excited about is like what I've done with my daughter. So the effect I've had on my daughter. So my husband and I did a fun thing. Well, fun for us, maybe not for everybody because we're weird and we're in the medical community. I actually took the ACE test and I took it myself. Now, one thing I don't like about this test is it's very subjective and I like things that are very concrete. I'm a neurosurgical ICU, hard charging trauma nurse. I like things that are very concrete. And when you read it, it's a little bit subjective, right? So you can answer it. If you're one of those people who thinks of your childhood as very traumatic, you're going to answer it in one way. If you think of it and you don't want to think of it as traumatic, you're going to answer it very differently, right? So I'm reading this and I'm like, yeah, you could answer that one of two ways. And I'm trying to put the numbers down. I'm trying to get them lower. So as I'm trying to answer these, lower, I ended up with a 7 out of 10. And I'm like, I don't really like that. Like, cause it could have been lower if I, depending on how you read it, and I'm like, I'm trying to like,
I had a better attitude.
Yeah. I'm trying to fudge the numbers. And so I tell my husband, I want him to take it with me. And he's like, no, you're like, when he takes it with me there, it's an 8, it's a solid 8. And I'm like, I still don't like it because it's subjective. So I cut it in half. Just because I wanted to. I'm like, I'm gonna cut this in half because I don't like the way this is written.
You want to get a good grade.
I'm very, very competitive. So I make it a 4. Well, guess what? If you have a 4, that's what puts you at risk for 7 of the 10. And that's when I went, oh, wow, I need to pay attention to this. I cut it in half and I got a 4.
And you still failed. Yeah.
And I still failed. And so I took it for my daughter and she got a 1. And that's when I realized, okay, I'm doing something right because she's had a completely different life than what I had. And so that's what excited me is we can make a difference. We can make a difference.
You already have. How old is your daughter now?
She's 17. She's getting ready to go to TCU. She's going to college. She's got a 4.2. She is just, she's one of those kids that you just look at and you're like, wow, she makes you so proud.
Okay. Well, let me ask maybe an elementary question though, but when you talk about, now you said it from a biblical reference, the sins of the fathers, you said the righteousness of the fathers, let's just say genetics for those who may not be of that faith, that genetically, so in your trauma, because what you said in essence, because of the trauma and the damage that it did to your DNA, your daughter has that. She has
the vulnerability. But I think that just because when I think of genetics, just because the gun is loaded doesn't mean we have to pull the trigger. Our lifestyle is what pulls the trigger. And that's functional medicine in a nutshell. Just because we have the vulnerability, I am loaded it's ridiculous. So when I was living a different lifestyle, you saw that coming out constantly. When I was a child eating frosted flakes, Fruit Loops, constantly in fight or flight, no one was there. I was terrified. I was molested as a child. All these things were happening. You saw that in my life. But now I'm living a different lifestyle. I'm in my 50s and I'm healthier than I've ever been. So genetics load the gun. Our lifestyle pulls the trigger.
Okay.
Largely.
No, absolutely. We love that statement. I mean, we had Dr. Bredesen on not long ago.
Oh, we love him.
and he talked about the same thing. Of course, Randy talks about it a lot. As a doc and in the practice. So, okay, but let's say that you had 2 kids, your daughter, you had twins. Okay. They both have that, as you said, this DNA degeneration to some degree from your trauma.
Yeah.
Now the lifestyle, as you said, the lifestyle that you have given your daughter has brought her to that, to a 1. If she had trauma though, if trauma were to enter her life, we would say she has a predisposition to be, so trauma being the trigger. We were talking about that just at lunch. So we talk about lifestyle pulls the trigger. Is trauma one of the primary triggers for that prior damage. Because even though you have given her is it fair to say gosh, I don't know how to say that, a lifestyle and therefore a psychology that's a 1, she could still have damage to her telomere. She could have a terrible telomere score.
She could, but we've also educated her that it's pretty hard to get through life with no trauma.
Right.
And therefore, these are the tools. These are the tools. It's pretty hard to get through life unscathed. COVID was trauma for her generation. She was devastated. That was the first time I saw my daughter go into a deep depression. She'd just gotten her driver's license. Now it's, it's easy to say, oh, well, that generation is spoiled. Maybe they are, but it was still hard for them. You can't gauge it for people. So she had just gotten her driver's license. She had just gotten her first job, and she was starting her senior year. And that was devastating for her. She went into this deep depression, and she was like, this was all taken from me. She's like, I feel like I'm put on restriction and I didn't do anything wrong. I've been a good kid. And she's very social. So she went into this very deep depression. And so we had to work with her through that. And we're like, you're not going to get through life. Life is going to throw you curveballs. You've got to have some tools to work through it. Okay. So that's the key, I think, is really working with people and giving them these preemptive tools and teaching them how to manage their life.
Yeah, I was going to say that
we want them to have reserve,
which is resiliency.
Yeah.
Right. They can bend in the wind. And even though she was born with a predisposition, the environment that you purposefully, conscientiously, and preventatively, if we said it that way, brought her up in, giving her those skills and those coping skills are a part of what she's not going to get through the rest of her life unscathed either. And we don't teach kids that. We teach to the trauma. You have to be ready for it, obviously prevent it. But when it's there, you want to be resilient enough to bend in the wind. And her genetics, her DNA, I also believe is then when she passes that along, that next generation down has less of the predisposition. Yes. So and we live in a culture where it's going the other way. Our genetics are unraveling, so to speak.
Yes.
We're weaker. We have more and more traumas and more perception of trauma. People don't have the coping skills. They feel the trauma as worse. And I think that is part of the shortening of the telomeres and the weakening of our genetic resiliency, so to speak. But we as adults have the option, like you, to shift, to change, to decide to live life a different way.
Well, I love what you're saying. And it just popped in my head because we focus a lot on the trauma. And I certainly did for a while. I focused a lot on the trauma because I was living it and it was just hard not to focus on it. But we can also focus on the other part. There's a lot of things about my family that I disconnected from them. I did not want to be like them. To survive and to get out of it, I disconnected. But there's a lot of things once I went through the healing process that I realized there's a lot of things about them that I do like my mother's grit. My mother she's intense. She survived. She actually now is retired, a wealthy woman. No one would have counted on that. She's got a ton of grit. So I inherited that too. My daughter inherited that. So if we focus on the things that we want to, they're the positive parts, there's those as well. And that's the resilience. So that got passed on as well. And I always tell my daughter, I'm like, stop praying for life to be easy and start working on the skills. Pray for the skill to get through it. Mm-hmm. Pray for the strength to get through it. Life is not going to just be easy for you. And it shouldn't be. That's one of the reasons I practice martial arts and not dance, because I love the metaphor. They teach you how to fall and get up fast. You don't lose unless you don't get up.
There's Tana, if you're not aware of it, there's a guy, an artist, music artist that I really like, Andy Grammer. Guy we got to meet a few years ago, and he has a song out that my wife is really attached to, or so she really appreciates, and it's called "I Wish You Pain," and it was a song to his new little daughter. And at face value, it's a difficult song to listen to. I think, especially if you're someone like my wife who also experienced trauma in her childhood. But yeah, when we look at our kids, especially, I want them to be safe, have a safe trip, be comfortable and be okay. And yet we know that doesn't build strength in them, doesn't build resiliency. But my gosh, on the other side, we have, the trauma that wrecks people. I mean, you talk about, and I remember that in our first discussion together on the Ziglar Show, that in your book, you don't spend much of any time expressing negativity towards your mother who allowed you to be exposed to a lot of trauma.
Yeah.
And my thought was that's got to be a bid in your favor of health to have a better perspective. And yet over here, though, I mean, from a health and wellness, the next patient that walks in the door, what I hear you guys saying is they need to be really aware of their ACE score, of their trauma, as it is going to cause a predisposition. No different than I've got an adopted daughter who comes from a Native American background, and her predisposition for diabetes,
Right.
her issues is high. Us being able to know that allows us to cater to that significantly. And being unaware would, I think, cause a lot of problems. So, we're talking about putting a good perspective on it, writing a better story about it, but also being aware. I mean, that's a tension that people are going to have to hold. It's not always so easy.
Absolutely. Absolutely. I think that's a great point. And, my mother, she was challenging when I was young, but she's also got so many great qualities. And it's, when you do start going through the healing process, there were moments where I did some EMDR therapy, which is a type of therapy specific to trauma. And as I did that therapy, all of a sudden things became a little more clear. And I was like, yeah, things weren't great in my childhood. You have this full
Yeah.
circle, these full circle moments where it was the first time I sort of became frustrated or angry at her. But then I came full circle and I realized, her life was much harder than mine. And so she went through way more than I did. She was a 16-year-old runaway. So considering where she came from, she actually did okay. So
Well, when you talk about, Tana, you mentioned helping people with tools to deal with this. So if you know that you have significant trauma, well, like you said, okay, understanding that we all have trauma and how we perceive that is as important as anything. But especially to those who have had significant trauma over here. Now, of course, as we would do on all the shows, so what can you do? Everything, address everything in your life. And the more health and wellness overall is going to help that foundationally. But when you talk about this specific issue, and if somebody were to ask me, I don't know, what are the tools? What are the primary tools that you're going to look at somebody like yourself who has significant trauma that they're going to need to utilize more so than somebody like Kevin, who didn't have any real acute traumas in his life?
mhm.
Is that a fair question?
um yeah, I just
I mean, what is somebody, I mean, obviously somebody got diabetes, we're going to look at their diet specifically, but when you've got
yes. So I
trauma,
think,
what am I going to do?
but
What
I
am I,
think here's the thing. I think so. I listened to one doctor talk about this, and she said, if I have, this is what I love how she said it. I was trying to think of how to say this. She said, if I have 100 patients that come to me and they're drinking out of the same well, I can either give all 100 of them the same antibiotic, or I can go to the well and look at what's wrong with the water
right.
and
Okay.
treat the water.
Perfect.
So I think, it's, yes, you want to, you have to put the Band-Aid over the wound, but if you don't treat what's causing the wound, it's just going to keep happening. So I think it's really important. This is what I love about functional medicine is you do a full assessment. You're not putting Band-Aids over bullet holes. You're trying to get to the root cause. So yes, if someone's got diabetes, you have to treat the diabetes, but you also need to do a full assessment and figure out what's happening.
Yeah.
Like, what did they go through? It's got to be a complete assessment. That's why at our clinics, we treat people according to 4 circles: biological, what's going on with your brain, your body, your hormones, your thyroid, everything, your HPA axis, which that's going to get a little tricky if we start getting into that now, but that's what turns on your flight or fight response. And if that happens early in life and it gets stuck on, that's really damaging, right? For the rest of your life to your body. It's very damaging and it causes you to age and it causes lots of diseases. So we look at all that. That's your biological. There's your psychological. What are your thoughts? What do you think about what happened to you? And how are you managing your thoughts? Your thoughts lie. They lie a lot. And even if they're not lying, how are you managing them? Your social circle, because who you hang out with matters. If you are traumatized, you're more at risk for substance abuse. And if you're trying to get clean and you're hanging out in a bar, that's not going to help you. So if you're going to church, that's why this was devastating to us during COVID, because a lot of people who had their support system through church lost that very hard, or they lost their AA meetings or whatever it was that was their support system. Very difficult. But then there's also your spiritual circle. People who have spiritual support and have believe in something that's beyond themselves, they live 11 years longer. And it's, so all of those are important. But yet when you go to the doctor, typically they treat they treat the wound and they give you a medicine and they put a Band-Aid over a bullet hole. And they're not looking at all of that. And that's why functional medicine is so important.
I couldn't say it any better myself. That's obviously what we talk about every day. And it's a big missing piece for so many people. And how often when you ask those probing questions and say, okay, upstream, or, what's the cause of this problem? By definition, for everybody, we're all on the spectrum of everything. Everybody's had some degree of a little bit of trauma or perceived trauma in their past. And so let's go there. Let's be open and honest and gracious and gentle and with no stigma to people and teach them. And so that's kind of where I think the people that are listening right now, everybody has to hear and understand, oh, that's me.
Right.
Now, it's not, molestation, abuse in everybody's case, but nobody gets through unscathed. So it is you. So then what's the response? And the response for most people is, I don't want to think about this.
Right.
In fact, I think I'll have a donut.
Right.
Or I think I'll just keep right on working and I'll be addicted to my work or to my other hobbies or something like that. And another day goes by. And what you and I have learned down the functional medicine and the neuroplastic pathway, that just like you can heal, but the more you stay in that unaware, unconscious, if it's fight or flight stuck on all the time, or if it's depressed and hide in a hole all the time, as you do that every day, you're more likely to do that the next day.
Yes.
And so our encouragement, I think, is as people hear this through our lens, what we're always talking about is you have trauma. We all do. What is your response to it? And I think that first response today is awareness, is acknowledge this, be open to it, assess yourself. How do I perceive it? And then if it is there, especially if it's been significant, what are you going to do about it?
Yeah.
Well, absolutely. And we get criticized for treating people this way, which is so weird because we don't want to just give people pills. We want to teach them skills. We want to understand why it's happening. We want to teach you, about nutrition and lifestyle. And that's why we have so many functional medicine doctors that work for us. We want to know what's happening with your hormones. Did you have Lyme disease? Is that why you're getting sick? It's so many things. But trauma is a big part of it.
Mm-hmm.
If you've had it.
Yep.
If you've had trauma, then we want to understand that and we want to be able to talk about it and get through that rather than just medicating it.
She just gave the book title, Skills, Not Pills. A chain of functional medicine clinics. Well, you just mentioned neuroplasticity. So you talked about your ACE score. And again, I'm going to ask an elementary question because I'm not super familiar with it. I need to get more familiar with it. Well, first off, just on that, because we keep talking about it, can you just go get an ACE score? Can somebody go online and take an ACE score? Okay.
Anybody? I think it's aces.com.
Is
it?
Okay.
You can find it.
Okay. That ACE score. So for you, Tana, you talked about, you took it. It is not going to change, correct? Your ACE score is your ACE score.
You can do what I did and cut it in half just because you want to have a better score.
If you're honest, it's not going to change. So it is what it is. It's saying this is your makeup. So when you have a telomere test like this, and they're saying, okay, we're talking about your chromosome health, and one of the primary causations of bad telomere health is an ACE score.
Right.
Well, you can't change your ACE score, but we are over here saying you can change your telomere health, but but maybe not in relation to your ACE score?
No.
Does that make sense?
You can slow down, or you can stop the progression, like from being you can stop, I don't know if you can stop it, but you can slow the progression of the damage, I suppose. You can.
Yeah. It's
there's some
like
evidence you might even be able to reverse some of it, I guess.
I would believe, I'll use the word believe that you can.
But this is like Alzheimer's, and we're saying, not only can you stop it, but Bredeson's saying, you can reverse it. Parkinson's, which we just did a show on.
Reverse it. I mean,
okay. Not everybody all the time, but yes, it can. Right. Maybe a better example here is talked to a guy yesterday and he had a 25-pack year. So 25 years of a pack a day of smoking. And then he quit. He has that in his history from now on and forevermore, 25-pack years. Right. But the longer he lives in such a way as to give his body what it needs to heal from that, he will be healing more and more. Same is true of any toxin or or even an emotional toxin that damaged you, it did its damage, and you can still live life in such a way as to give your body what it needs to be as resilient and as well as possible, but you cannot eliminate that from your history. So we don't talk that way. It's how do you think about it?
Mhm.
What is your relationship now with yourself
Yeah.
then and now and in the future? And again, in American medicine, that language it just doesn't translate into an ICD-10 code or a pill for an ill or those kinds of things.
Right. And we did the big NFL study, one of the first big NFL studies on
On the
live
CTE.
patients. Dr. Amalo did it on dead patients. He's a friend of ours.
Right.
We did it on live patients. We've scanned over 300 NFL players, and it was not pretty. It was not good.
Yeah.
And so the damage was extensive. It was terrible. And these guys had not only, they had a lot of brain damage, but as a result, a lot of them had a lot of trauma growing up. These are guys that have had a lot of
Yeah.
trauma growing up. They had significant brain damage. They had a lot of addiction. They had also bad lifestyle, lots of problems, incarcerated, a lot of them, lots of issues. But when we did the study, my husband, he went, I don't want to do the study and look at the brain damage. I want to see if there's something I can do about it.
Right.
So we actually did a study. The follow-up study was to see, and we actually did minimal because we were actually funding it. So we did the minimal that we could to see what we could do that we could afford to put them on. It was a brain healing program. And so what we did is we did supplements, lifestyle. So we changed their diet, and exercise, and it was really fairly simple. So it was a basically like a neurotropic type of supplement that we created: fish oil, vitamin D, and a multivitamin, and then the nutrition and the exercise. And so I actually led some of those programs at the clinic, and it was great. We did and the follow-up study, what was amazing, 80% of them had significant improvement. We've got the scans. And so I would venture to bet, now we didn't follow up with telomere health, which we should have. That would have been really fascinating. But if their brain is getting better, which we never used to think that was possible. If your brain is improving, it's pretty fascinating. I would really venture to bet that somehow your telomere health is probably doing much better than it was. And Anthony Davis, who's one of our patients that we did this with, he's amazing. Notre Dame killer is what they used to call him. And we actually scanned him, and his brain was terrible when we first scanned him in his 50s. 10 years later, his scan looked better than his original scan, significantly better. So we put him in a healing environment.
It's so encouraging to know that the brain can heal. It wants to heal. It is built to try to be healing. It's a little bit discouraging to know that all of us growing up in America, I too grew up on Cheerios and Fruit Loops, and we just do everything that we can to stop the healing, and we call it normal.
Yeah.
And did you guys publish your study?
It's published. Oh yeah.
Yeah.
And it was written up in Discover magazine.
Yeah, great.
It was in the top 100. Yeah. It was in the top 100. It was written up right after Tesla, the Tesla battery.
Yeah.
It was very cool.
Encouraging.
You guys talking about the brain can heal. So I'm going to again come back to the next patient who walks in. And so patient A comes in and has a predisposition towards the diabetes that they're dealing with right now, possibly. And you're going to deal with that in the functional medicine framework that you deal with that. And I'm going to think more of a physiological standpoint. And we know it's all psychological, more physiological. And somebody comes in with an autoimmune issue and whatever. When you have that patient that comes in again with this trauma, with a high ACE score, or trauma, even if it's afterwards, but they've got trauma. It's a big part of their life. A soldier. So, who may have a great ACE score, but then they went to war, come back and it's PTSD. I mean, we are talking about then, as far as kind of back to my question on tools, there's a lot more psychological focus. And I saw you drinking your mug with the Quiet the Dragon symbol on that. Is that where that focus with you and your husband is coming from?
Absolutely.
Okay. Talk about that a little bit. And you also, before we got online here and we're talking about the increase that you were citing in child abuse. Was that it?
Yes, child abuse right now. There's new evidence that child abuse is going through the roof. So calls to child abuse hotlines is way down because their mandated reporters can't see them. So they're not in school. Nurses aren't seeing them. Teachers aren't
Oh,
seeing
wow.
kids.
Yeah.
And not only that, opiate and alcohol consumption is way higher, and kids are at home doing school.
Now,
And
do you mean
so,
right now, just since the pandemic as a result?
yes,
Okay.
significantly higher. So we think that it's I forget the percentage, but we think that it's significantly higher than it's ever been. And it's going unreported, and sexual abuse as well. And
Mhm.
so it's a really scary time for a
So
lot
we're
of people.
talking about something that right now we're going to see manifest in
So Dan, my
what?
husband keeps saying the new pandemic is mental health. He's like,
Yeah.
you need to be, washing your brain as much as you're washing your hands, and not in brainwashing like the negative way, but washing your thoughts and cleaning your thoughts and really taking care of your mental health like you are your hygiene.
Yeah.
But we're not doing that. And the problem is we're just seeing our clinics are busier than they've ever been. We are at an all-time record high. I mean, it's crazy. We've had to hire more doctors. It's been insane.
Well, when we look right now, aren't they saying that the fastest growing, not the biggest area of chronic illness disease, but the fastest growing is diseases of despair,
Yeah.
is what I've heard. I mean, so,
Depression, anxiety, and suicides right now are just through the roof.
oops, sorry. And so how much is trauma a piece of that? If you guys are citing that's the next pandemic.
It's a lot. And the problem is right now with children, we're not seeing the reports. So that's the problem. We're not actually seeing it. And when you see them going down from the norm, it's not because they're going down. That's
It's
that
just
is not usually
unreported.
what's happening. It's that they're not being reported.
And when perpetrators know that they're not being reported, that actually goes up. And we're not going to see the statistics on this for
Until,
maybe even a decade.
right.
You know, and the consequences of this, like Dr. Amen is saying, is going to be a 20-year
Yes.
pandemic of
It's
the
terrible.
consequences.
Yeah,
So
we're about to hit a huge mental health pandemic.
At the same time as the aged ones are becoming more demented,
Mhm.
more,
Yep.
at the same time.
well, so hit on your, quiet the dragon position you guys are, because we are talking about, so obviously we can do all these things from bolstering the system, the functional medicine, which includes the mental side of it, but to go over here and talk to these people. So those who are listening right now, they know they have, bad ACE scores, or they've had big trauma in their lives right now. Talk about the brain training, neuroplasticity of how we talked about this again in the first show, you talk about it in your book, how you reframe it, and what the possibilities are from that.
So this is actually based on my husband's new book. Your brain is always listening, and he actually talks about these dragons from the past that breathe fire on the emotional centers in your brain. So it's actually very cute. We have a new public television show that's out that we did on both of our books. We've never had books come out at the same time. So my book came out, which is The Relentless Courage of a Scared Child, at the same time his did. His is more the science, and mine is, oh, this is what happens when you live this kind of life of trauma. And so his is really about these dragons that really are from your past and what happens when they breathe fire on the emotional centers of your brain. But then how do you tame them? Like, you're not just stuck with this. Like, what do you want to do? How can you tame these dragons from the past? And one of the big ones is the ancestral dragon. It's really that some of these issues that we have are not our own. They're passed on to us. They're generational, right?
Mhm.
But things like what are going on right now, the pandemic, that is something we're going to have to deal with. That is something that we have to learn how to deal with. That's a trauma that we need skill for. So
When you you talk about an ancestral dragon. I mean, we're back to that again, to other people suffering from trauma that wouldn't know it. Cause I say that I haven't thought about this till right now, Tana, that I would say, okay, I do not have trauma, significant trauma. I really don't. Just, I had a very sheltered, privileged, lifestyle. However, those behind me, ancestors, there's stuff back there. I've never considered that in regards to my own health. I mean, we've got this, this phenomenon, or not fad or whatever, people going after the genetic test with 23andMe and what is it, ancestry.com, that's going to tell you that you're this much percent Irish, or you have a predisposition to diabetes. It can go that far, right?
Yeah.
But it's not going to hit on trauma. We're not going to pull that out of it.
well, this is interesting. So there was a study done with mice, and they actually exposed them to the smell of cherry blossoms, and then they shocked them. and they kept exposing them to the smell of cherry blossoms, and they shocked them. So they became terrified of the smell of cherry blossoms. And then they took their offspring and they did not shock them, but they exposed them to the smell of cherry blossoms and they were terrified.
That's nuts.
They like started shaking. So that's what we mean by generational trauma. Sometimes the trauma you feel, you don't know why. You might feel certain things or be terrified. So for example, my grandmother, she came from Greater Syria, now Lebanon, during the war, and she went through the Great Famine, and she was lost as a child in the mountains by herself and almost died of hypothermia. And it was a big thing in my family. She never got over that trauma. And then she also lost her son, my uncle, who was murdered. So she went through these significant traumas. And I remember my grandmother having severe PTSD, which back then wasn't talked about. She would cry and wail like all day long. And she also used to hoard. She hoarded things because she was terrified of another war. So she used to keep like little butter dishes and used tin foil. She'd wash it off and she would keep it. She was terrified of another war. She kept a ration card on her dresser and she'd cry all the time. Now, I never went through any of that, right? I went through other trauma, but I never went through any of that. To this day, I was totally prepared for the pandemic. I have a survival room. I have food and water for a year. And my husband would always go, why do you do that? Why are you spending our money on this stupid stuff? Why do we have all of this crazy stuff? I've got medications. I've got IV bags. I'm pretty extreme.
Wow.
And
I'm coming to your house next pandemic.
Right. And I don't know why. He's like, why are you saving for the zombie apocalypse? And I'm like, I don't know. I just need to do it. And so when I really dug into this, I'm like, maybe it's because of my grandmother. I don't know for sure, but maybe that's why.
I mean, so you guys both, I mean, again, to the average patient out here like me. So I feel from what you have shared, I'm all of a sudden motivated to go research a little bit more about that, my background, about the last generation, the generation before that, which most of us don't know. And at best, we just know something about their, where they immigrated from or whatnot. To find that out, to understand. I mean, something like you, Randy, I mean, you look and think you had the privileged lifestyle, and yet your telomere scores were not so great, if I can admit that. And what happened, the generation before that and the generation before that. So it would call, so a guy like me, so the prospective patient, call me to understand that. But then of course the danger there, and we've had people, I remember back when we were doing telomeres, say, I don't want to know. I don't want to know. And we're saying, no, you should know. You should know that predisposition. But though, if you use that now and you're a hypochondriac, you can take that the wrong way. So we need to be aware, but we don't need to say now, gosh, now I am so susceptible to everything because I had this happen to great Aunt Harriet back here. But there's a tension there of knowing, you should know, again, just like my daughter, to know that she has a predisposition towards a diabetic possibility over here because of that is good for her. But we don't want her to be afraid of food. We don't want her to be a victim and have that mentality either. So it's almost a dangerous path that we've got to hold here, isn't it?
I don't think so, but I mean, I have a different perspective. So, I mean, I would venture to bet, most functional medicine doctors think that when we look at someone's brain, we would just tell you it's better to know, because if you could get off tracks of an oncoming train, do it or not. A train coming at you, do you not? You have what you have. It just is what it is. You have the opportunity to do something about it, and you want to or not. It's really more just, there's a train. Do you want to get out of the way or you don't want to get out of the way? Yeah. Or it's going to be good news.
Right. That we had actually early on in the 23andMe days. Actually, it was even earlier than that. It was the APOE. And I had done the APOE on somebody as part of a standard panel and she was very offended. And
really?
Yeah. And so there's been a little bit of an evolution of thinking process there. And then I went through a phase of saying, it doesn't matter what your parents did or said, because that just loads the gun, but your lifestyle is what matters in terms of nature versus nurture. But you bring up this tension, this interesting thing, like for your daughter, I think it's incredibly important that from an early age, she understand this. Yeah. But then you bring up me and yeah, it's no secret, Tana. So my telomeres are less than 1%. So I am worse than 99% of everybody out there.
Isn't that weird?
Well, it
It's
is.
weird.
And
It's-
that's what frustrated us, because here we are, we're almost the same age, very similar upbringings,
yeah, an ACEs score of 0, and
lifestyles, and everything. And even to the way that we live today, and we got ours, and I'm like 80 something
yeah, you
percent.
were at 88 and I was at -1.
And it was
So
really
trying to figure
frustrating.
that out.
Yeah.
So for me, I think that I'm not that interested in my ancestry, or outside of the fact that, okay, it could explain something like that, but I
It
know
doesn't tell you what to do with it.
it doesn't tell me what to do
Right,
with it
you
if
don't
I'm
know
already
what to
doing the
do.
things that I
Yeah.
think I could do.
Yeah.
So Kevin, what you said is it's tension. I don't want people out there to hear, oh, so what you're saying is if I get my telomeres test and get my ACEs score, I'm going to know if I'm going to be healthy or not.
Right.
I'm going to know the right thing to do or say or think. And it's like, no, not any more so than we can tell you exactly what to eat, and you're going to be perfectly healthy for that. But I think what we are saying is awareness, like we always say,
Right.
of your trauma and of
Yeah.
your perception of trauma, and the fact that that can have if you're suffering with, well, like Tana, 10 surgeries that are unrelated and weird and whatever, or somebody with multiple of the top 10 chronic issues in our country, and you don't address what happened in those early years, oftentimes, or first responder or trauma or war, or things like that, then that is an upstream thing that you can really that you can take action on and have a big impact in your brain health and your body health.
Yeah.
Yeah, I think it's important you don't leave people, if you're going to give them the bad news, you can't, or whatever news, you can't leave them without a plan, number
Right.
one.
There's a way to get off the
There's
track.
got to be, right. There's got to be a way to get off the track
Yeah.
and do the best they can. But my husband has this interesting saying. He said when he first became a psychiatrist, he thought his job was to really alleviate everyone's anxiety. And over time, he began to realize that wasn't his job. His job for some people was actually to increase their anxiety a little bit, because some people need a little anxiety to get motivated to do the right things.
Move.
And so it was really interesting.
That's interesting, because I was sitting here thinking, I mean, if we took the functional medicine tenets, or just good lifestyle, we're going to put it all over here and go, okay, here's as close as we can get to this perfect life that we're all going to strive to do, with each of us with our vices and whatnot, that if anything, this is extra ammunition for accountability to just.
Right, it's accountability. And you have to have a little anxiety to have accountability. I'll never
Yeah.
forget my daughter when she was in 4th grade and she got a really good grade on her one of her first big, projects she had. And I kept telling her, you can relax. You're so uptight about this thing. You're working way, way too hard. You've got a month to get this done. And she was so anxious. She got it all done right away, like in the first week. And then she got an A on it. And I'm like, see, I told you, you could have relaxed a little. She goes, do you know why I got a good grade? Because I'm anxious.
Okay. Well, however you want to use that ammunition. Sure. Well, Tana, just, even to wrap up with this, when I look at you've got a very active, social media. You guys have a lot of followers. You and your husband, Daniel, have, Dr. Amen, have a lot of followers, and on social media and Instagram, I think I'm connected with you there, and I see you, and you do a lot of postings about trauma. Where do you find your primary, I was going to say, advocacy or voice, or what are you speaking to when on the topic of trauma? What's the most consistent thing that we're going to see from you advocating?
I think that your history doesn't have to be your destiny.
Okay.
That you really, I think finding your voice, drawing boundaries, your history doesn't have to be your destiny, I think is the main thing. That regardless of where you came from, it doesn't matter so much where you came from as to where you're going.
Okay.
I think is more important.
Okay.
Well said.
Well said. Tana, thank you. Thanks for coming and sharing more on this. It's exciting and eager to. And what's the best resource if we're going to point people towards more from you guys on this topic? Where do we want to go?
So you can either go to tanaamen.com, amenclinics.com if you're suffering and you know someone you want to find some resources for mental health. You can follow me at Tana Amen.
Okay. All right. Tana, thanks again for giving us your time and your insight.
Thanks, guys. I really appreciate it.